At Wembley tonight, a public inquiry into appalling failings within the Mid Staffordshire NHS Trust believed to have contributed to the deaths of at least 400 patients, maybe as many as 1,200, calling for a zero-tolerance approach to poor standards of NHS care in England. In his second highly critical report, Robert Francis QC describing a failure of NHS systems at every level. Let's get the thoughts of Aidan Burley, who's Conservative MP for Cannock, and David Kidney with me in the studio as well. David was the Labour MP for Stafford at the time. Aidan, good evening to you.
Good evening, Paul.
Your response to the report, first of all?
Well, I think firstly I'd say today is a day to remember the victims and their families, and I think we should hold them in our thoughts because they're the ones that have suffered from what went on at Stafford Hospital, including, of course, many of my constituents from Cannock Chase. And I think the second thing I'd say is, I thank Robert Francis for his report, and actually also pay tribute to Andrew Lansley to having to committing to a public inquiry back in 2009. This was, of course, a public inquiry opposed by the likes of Andy Burnham, who said that it would interfere with the running of the trust. And I think everybody would agree today that this is a very well-researched and wide-ranging, serious report into why regulators and NHS managers failed to pick up what was happening at Stafford. And really, thirdly, I'd say that the thing that comes out of all this report for me is that there was just a blind pursuit of targets at all costs, which is just wrong on so many levels, including on a moral level. And what happened with this trust is that when problems began to emerge, they weren't open and honest about them, but actually they closed ranks when things went wrong. And I think those are the very profound changes that we need to make within the NHS to make sure that Mid Staffordshire never happens again.
290 recommendations. We'll be talking to the current Chief Exec of Mid Staff's NHS Trust in this half hour on the show. But as it stands right now, Aidan, if you got ill and you needed to be taken to Stafford Hospital for treatment, would you be happy to go?
Well, I think that Stafford has, improved a lot, a long way since the dark days of 2005 to 2009, which is when the real problems occurred, and this report covers. But the thing I always think is that
Aidan, would you be happy to go?
I would be happy to go, but
did you say you would?
I would be happy to go to Stafford Hospital now, yes.
Right.
But the point I would make to you is that as an MP, if I look at the way, for example, schools are regulated, I know in my constituency every school and how it is ranked, whether it is outstanding or poor, and the levels of service. And we just don't have that same openness and regulation of hospitals, and we don't know which hospitals are outstanding, poor, and so on, in the same way that we do, for example, with schools, which is why I think the recommendations such as the CQC will be a new inspector of hospitals, which will actually be able to perform a judgment, not just have statistics and metrics, but actually have a judgment saying, is MRSA going up? Is that a cause for concern?
What about a revolutionary idea of more nurses, better trained?
Sorry, say again?
What about a revolutionary idea of more nurses, more spending, so that people can get better care on the NHS in hospitals?
I mean, I don't think this is all about spending. I think actually this is about hospitals reaching minimum standards, and if they don't reach minimum standards, they're put into a failure regime. And actually, one of the things that emerges out of this is there has been a huge focus on finances historically, and not enough focus on clinical outcomes. This trust, during this period, 2005 to 2009, when hundreds of my constituents and people from across Staffordshire were needlessly dying, was actually given foundation trust status, which means that it is an exemplar trust. It is now being reviewed by Monitor and is likely to be dissolved by the end of the year. So if just 4 years ago it was supposed to be an exemplar trust, it's about to be dissolved. And the FT status was all about focusing on the finances of it, and actually at the expense of clinical outcomes. And I think one of the big learnings from this report is that the clinical outcomes for patients must be put first before the analysis of the books.
But as it stands now, is the NHS just unable to cope because of the number of staff, the number of nurses, the number of people who should be on hand to treat and care and show compassion?
Well, actually, I think there's 5,000 more doctors since the government took over and 4,000 fewer managers. So there are more doctors and nurses. But I think we need to learn the lessons from this report. We need to make sure that when frontline professionals who love and care about the NHS they work in actually have concerns about the standards of care, that we have a system that allows them to speak out, to be whistleblowers, and that they don't have a fear of exposure or victimisation. We've seen in this report that people did have concerns, but they didn't feel able to speak out about them.
Yeah, well, that's one of the big issues. Aidan, stay with us if you will. David Kidney's with me as well in the studio, Labour MP for Stafford at the time of this Stafford Hospital scandal. David, thank you for joining us.
You're welcome.
Were you aware of what was going on? Were you contacted by family members of patients at the time or not?
I wasn't aware of 99% of what's in this report now, and indeed the first one. But bear in mind, I mean, I lived in Stafford, I still live in Stafford. I used Stafford Hospital for my care, and I still use Stafford Hospital for my care, and I was in and out of the hospital. So, you know, I was there regularly, and all I can say is that these things didn't come through channels to MPs in the kind of numbers that would have set alarm bells ringing.
MPs mentioned by Robert Francis in this report. He hasn't designated individual responsibility, but did you feel that there's more that your government should have done, that you could have done as an MP?
Well, there's two things there. Should I have done more or could I have done more? Well, now I read back on two reports and, for goodness sake, wish there was lots of things I did in terms of noise and questions that would have brought this out earlier, and I shall kind of live with that for the rest of my days. As far as government's concerned, clearly there were parts of the system set up by government, regulators, organisations like Monitor and so on, and health managing organisations, who all knew something about what was wrong at Stafford Hospital. And what they didn't do, any of them, is put the pieces together so that somebody had the full picture and said, this is unacceptable, we must do something about it. And that's at the heart of what Francis finds, and it's at the heart of his recommendations now about the standards that should be set for the NHS and the sharing of information within the NHS.
But presumably you heard one or two horror stories of what was going on.
Absolutely.
And did you follow those up? Did you talk to people at the hospital?
Every time, and
what did they say to you then?
The report says that when MPs did receive complaints, they made sure they went to the appropriate places, and that's true of me. But I was on the receiving end, as everybody else was, of these reassurances by managers that things were being done, that things weren't as bad as they sound, that they were doing things that now that I know the facts were not true. I mean, a very good example of this was the occasion when I was told by the chief executive face to face that they'd recruited 50 more nurses, and indeed that was in a news release that they recruited 50 new nurses. And when he'd gone and Anthony Samara came in and I went to see him, he said, David, I've checked personally the recruitment records of everybody who's working at this hospital, and I see no sign of such 50 nurses.
So they lied to you?
Well, clearly that was untrue, and it was in a news release, not just to my face.
Aidan, do you know whether people involved in this scandal at Stafford Hospital are still employed with the trust?
I think most of them have now left the trust. I'm still very angry that the former chief executive at the time, Martin Yates, never actually gave oral evidence to the inquiry, citing that old chestnut of post-traumatic stress disorder for the period during which he was chief executive of the trust, and then going on to be chief executive of another healthcare organisation. I think that's a scandal, and he should be called to account. But I think that most of the managers and clinicians, certainly the head and the deputy head of nursing, have now all moved on, and there are different people in place. So I think, David's right. We need to learn from this report. The report states very clearly that the regulators, including Monitor and the Healthcare Commission, fail to protect patients from substandard care. It says too many doctors, quote, kept their heads down instead of speaking out when things went wrong. It says the Strategic Health Authority was, quote, far too remote from the patients it was there to serve and wasn't sufficiently sensitive to signs that patient might be at risk. And we need to learn the overall lesson that pursuit of targets such as the 18-week waiting list, which would lead to things like giving the Trust Foundation status, is actually not as important as basic care of patients and making sure they're not drinking water from vases because they're so thirsty, and not lying in soiled sheets. And I think we need to get back to a culture of care rather than a culture of blindly pursuing targets for target's sake. And I mean, that's the culture that grew up over the last 10 years.
OK, Aidan, thanks for joining us. David Kidney, Labour MP for Stafford at the time as well. David, good to see you. Thanks for...